What is COVID-19? COVID-19 is an acronym for coronavirus disease 2019. Coronavirus is a type of virus that we've known about for many years, but this is a novel coronavirus, something we haven't seen before, something unique that seems to have passed from animals to humans, and many of us have not got previous immunity to anything like it based on prior exposures. This has led to a devastating pandemic that all of us are deeply affected by. It's changed our everyday lives. It's changed the lives of our families. And it's been very concerning to all of us as we see our friends and our families affected by illness, their lives changed, their work changed. And my goal today is to go through with you some information so that you'll feel more knowledgeable and more educated about what this disease really is, how to best protect yourself and your family, and to understand your options to improve your management if you should become ill. Coronaviruses are RNA viruses that, as I've said, we've known about for a long time, but this particular virus seems very different from what we've known about in the past. We don't know its mortality rate because although we know the number of people dying, we don't know exactly the number of people infected because of limited testing. We do know, however, that unlike other viruses, it spreads relatively easily in the population because we don't always know the patients who are infected. Many patients are completely asymptomatic and yet are shedding virus. In addition, after their symptoms resolve, they continue to shed virus. And this is different from our experience with other viruses. And because of that relatively long period of asymptomatic shedding and post-symptom shedding, there's a greater risk of dissemination. And it's been estimated that a large proportion of the population eventually will be infected with this virus. The disease can generally be a very mild disease. Probably the mortality rate of coronavirus is somewhere in the order of 1 to 2%. That still is higher than the mortality rate of influenza. But remember, influenza's mortality is affected by the fact that we do have treatments and we do have immunization. And so the natural history of influenza today is very different from what it would have been without these. Similarly, I think in the near future, we'll have therapies for SARS coronavirus, and we'll have preventive vaccinations, and those together are likely to modify the course of the disease. The other factor that we don't know about, but we know is developing, is that as more and more people get infected, they develop antibodies, and that helps eradicate the virus from the community as a whole, something that's called herd immunity. And the herd immunity can protect all of us going forward. What we're really thinking about is to not only attenuate the severity of the virus, but we're thinking about flattening the curve or delaying the time period by which many people become infected. Our big problem is that if all the people who are ultimately going to be infected get infected in a matter of 2 or 3 weeks, that will overwhelm our healthcare system. But if we can spread that out over months to years, then we can deal with this as we deal with other viruses. How does a person get COVID-19? There's been a lot of interest in coming up with a definitive answer to that question. And there probably are multiple mechanisms for the virus to be transmitted from person to person. We know, for example, that if patients generate an aerosol, it can be inhaled, and so you can have person-to-person transmission via inhalation. That's a complicated discussion because in order for that inhalation to be infectious, you need to be close to the person that coughed, for example, and you need to be in contact for a relatively prolonged period of time. So one set of investigators have suggested that you generally need to be within 6 feet of the person coughing and also need to have contact for maybe as long as 30 minutes. So the inhalation exposure has to be relatively prolonged and close. And that's part of the reason for our current emphasis on social distancing. However, there's also transmission by droplets, which may mean if you come in contact with someone who has the disease and they cough onto part of your hands, or if they cough into their own hands and you shake their hands, you can get person-to-person transmission from the droplets. And then if you touch your face using the part of your hand that has droplets on it, you can then transmit the virus directly to yourself through the nose, through the other mucous membranes, where you can become infected. So that's why it's so important to keep your distance from people, minimizing person-to-person transmission by an airborne route. And it's also important to wash your hands frequently and not touch your face. And all of these are part of the recommendations to minimize spread of this disease. It's also possible that if somebody coughs onto a surface and you touch that surface relatively soon afterwards, you might then pick up those droplets onto your hand, which you could again transmit to yourself by touching your face. Is everyone at equal risk of getting the virus? Again, a very important question. And I think in general, the answer is yes. I think everybody who comes in contact with this virus probably is at risk of becoming infected. And so that's why it's important that all of us do everything possible to avoid infecting ourselves, because if we become infected, we can easily spread it in our immediate family and social circle. What you've heard a lot discussed, however, is that there are people who become more ill than others when they get this virus. And in general, it's been observed that the elderly and patients with serious comorbid illnesses are more likely to become ill from this virus. But there are many things that we don't really understand. For example, it is very likely that we're going to learn that different people have different genetic predispositions to becoming mildly ill or more severely ill from this virus. Again, coexisting disease and age may be a factor, but we've all heard about younger people who can still get quite ill, and that may be related to genetic predispositions. So I think it's important that we recognize that this is a virus that all of us need to protect ourselves from, and yet it's not entirely clear who's going to become more ill than another. What is the incubation period of COVID-19, and can the virus be spread by people who don't have symptoms? Well, this is a really, really important question, and it needs to be seen in the context of what this disease is like. Probably 80% of all the people infected, and probably a lot more, have very mild illness, and many are often asymptomatic. So the number of asymptomatic people who are infected isn't clear, but it may be relatively large. And what we do know is that the incubation period of this virus, from the time you're first exposed to when you get symptoms, is on average somewhere around 5 days. And some people can have an even longer incubation period. During that incubation period, it is possible that people will continue to shed that virus. So that's part of the concern about always being on your guard, because you might come in contact with someone who's completely asymptomatic, and yet they could still be shedding virus. In addition, we know that after people get better, all their symptoms are gone, they may continue to shed virus for another 7 days and sometimes longer. And so we need to be extremely careful about who we come in contact with and washing our hands and social distancing, because of the fact that there are asymptomatic individuals who could still be spreading the virus. How can I keep from getting infected? I think we all would like to have a fail-safe mechanism to be sure we would never get infected. And I think there are a lot of things that we should be doing to get us towards that goal. Social distancing is absolutely key. Again, as you've heard about the spread of the virus, the less total virus you get exposed to, the farther you are away from people, the more you wash your hands, those are all key factors to minimize your chance of getting infected. I think it's also safe to go to your home, go for a walk, go to the grocery store when you absolutely need to. But I think it's important not to have unnecessary exposures and minimize your exposure to the outside world, which is exactly what we're being advised when we're asked to stay at home and minimize social contact. I do think there are other things that we should do. I think we should always wash our hands after contacts that are potentially infectious. And although it sounds sort of obvious at this point, you don't want to come in contact with people who are obviously sick and coughing. If you're coughing, you should cover your cough. And I think one of the key questions that's being discussed right now is, can you minimize your chance of becoming infected by wearing a mask? I think this is a complicated discussion, and I'll try to go through this very carefully. There are two types of masks that generally are available. There's the usual surgical mask, and then there's the specialized N95 mask. A surgical mask will cover your face, will prevent droplets from getting onto you, and a surgical mask will cover your face so that if you inadvertently were to touch your face, you would be touching the mask and not your face. So in that regard, it reminds you not to touch your face, and it covers you from droplet transmission. But it doesn't completely protect you from inhaling small particles if there was an aerosol near you. That's done with an N95 mask. And the reason that the N95 mask is so important for healthcare workers is that many of us are exposed to infectious aerosols during certain very high risk but necessary procedures, particularly procedures related to the airway. When we ventilate patients, when we put an endotracheal tube in, when we put certain types of respiratory devices on them, they may aerosolize the virus. And the people that are in the immediate area of patients with those procedures need to be maximally protected. And they do that with an N95 mask. I don't recommend, no matter what the guidance is in the future about putting on a mask, that people outside of the healthcare environment wear an N95 mask. And I say that for a couple reasons. Currently, for sure, if you wear an N95 mask or you collect a couple of them, then they're not going to be available for the high-risk healthcare providers. And that would be a shame if they couldn't get the masks that they need. But the other thing that's not widely discussed is every one of us healthcare workers has to go through something called a fit test. When we wear an N95 mask, we have to find out what's the right size that fits us. We have to learn how to put it on and how to make sure it's sealed so that we minimize any leakage of that mask. People outside of the healthcare environment who are wearing these masks probably have no idea whether they're wearing the right size and whether it's properly fitting. The other part about N95 masks is they're really difficult to wear for a prolonged period of time because you can feel short of breath wearing them. So whatever the ultimate answer is to wearing a mask, outside of the hospital, there's probably no reason to wear an N95 mask, and probably reasons you probably shouldn't. On the other hand, the surgical mask is a different discussion. And there's been debate and ongoing debate as to whether everybody should be wearing surgical masks wherever they go, independent of working in a hospital. I don't think we know the answer to that yet. And there have been, as I've said, changing opinions about this very early on, before there was a lot of community spread of the disease. Putting on a mask didn't seem to make a lot of sense because you weren't going to be coming in contact with a lot of potentially infected people. Now it's quite different with community spread of the virus. And there's the thought that the one reason to wear the mask isn't to directly protect you, but protect all of us. Wearing that mask will protect all of us from transmission by an infected person. So if the infected person is wearing the mask, they're not as likely to transmit the disease to you. On the other hand, when you're wearing the mask, it's potentially possible that something could still get through to you. Many people don't wear the masks all the time, nor can they. But the advantage of wearing a mask is the infected person doesn't transmit it. And again, as I mentioned previously, you're less likely to be touching your own face. So I think if we get to a point where we have an abundance of surgical masks, where you're using one will not take it away from somebody who truly needs it, then I think it might be a situation where all of us will wear masks. But it's only going to be working effectively if everybody wears a mask. Do I have to wipe down anything I buy or get delivered? That's a really tough question, and I'm not sure I know an exact answer. I think nobody would say it's wrong to do that. It's extra cautious to do that. However, how you wipe it down is also important. If you wipe it down and in the process don't wash your hands, touch your face, don't get rid of the rag that you wipe down with, it's probably not going to be very valuable. So if you're going to do it, I think you've got to do it extremely carefully. But given what we know about the virus living on surfaces, I think an alternative is to put the things that you buy in a place where they can sit for a day or 2 days before you touch them. And then for sure, they're not likely to be infectious. So I think there are a number of strategies other than simply wiping down everything that goes into your house. How do the symptoms of COVID-19 differ from those with a cold, flu, or allergies? A lot of viral illnesses look very similar, and often the COVID-19 symptoms can be just like a cold or flu. But the typical symptoms are fever, sore throat, cough, often not with any phlegm, and the one that we worry the most about is shortness of breath. We've also seen that there are some interesting and unusual symptoms with COVID-19. For example, this can be a diarrheal illness. And also, what's been described in some patients is they lose their sense of taste and smell. Now, all of that can occur with colds, flus, and allergies. But I think in this current period, where epidemiologically we know there's a lot of community spread of the virus, we need to assume that anybody with those symptoms has COVID-19 and take the appropriate precautions of quarantine and isolation from other people in your family. I think you don't necessarily want to be reassured by saying, I don't have this until I get a test. First of all, tests aren't that readily available, and you're not likely to benefit from getting a test with very mild symptoms. So I think the way that I would approach it is if you have any of the symptoms that suggest possible infection, you need to be very cautious and assume that you do have the infection. What should I do if I think I have COVID-19? Should I get tested? If you think you have it, isolate yourself, assume you have it, quarantine yourself for 2 weeks. Don't come out. And even if you feel better in 2 or 3 days, remember our discussion that you may continue to shed for some time after your symptoms are resolved. So I think you do want to go for the full 2-week quarantine. And if you have prolonged symptoms, then you probably want to quarantine for at least 7 to 10 days after all your symptoms and fever are gone. What about the testing question? Again, this question's been answered for us by the lack of testing pretty widely early on in this pandemic. But even if testing were to become immediately available, there are a couple of issues to consider. Today, at least, if you want to get tested, you've got to go to a site where you are very likely to come in contact with other people, many of whom have the disease. So if you were lucky enough to have these symptoms from a simple cold and didn't have COVID-19, and you went for testing in an environment where there are a lot of people who are infected, you're actually exposing yourself more. So what you've really got to ask at this point is, what will be the benefit of getting tested? Again, if you assume you've got it, you want to isolate yourself regardless. And if you don't want to go out in the environment and expose yourself to other potentially infected people, then there's not any great benefit to getting the test that should make you want to do that. So I think that testing is a difficult question. I think in the future, when the disease becomes under better control, or in the beginning, before it spread, testing might have helped us investigate contacts and so forth. But at this point, I'm not entirely clear that the juice is worth the squeeze. All the effort that you've got to do to get that testing may not give you tremendous benefit. The other really important thing to know about testing is there are occasionally false negatives. So if you've got all the symptoms and you go for a test and maybe your sampling method wasn't that great, they didn't really get a good deep sample and it's negative, and then you're reassured, I'm fine, I can go out and do whatever I want. That may not be correct. So I think the key thing is to be guided by your own symptoms. What symptoms call for a doctor's visit? This is a changing answer as well. I think I would have given a completely different answer a month ago, but things are different now, again, with community spread. So most doctors' offices aren't really open in the way they used to be. We're doing a lot of telemedicine, and generally we will talk to you, we will video chat with you, we'll review your medical record. There's some simple breathing maneuvers that I do with my patients when I do a telemedicine visit, and all of that gives me a pretty good chance of knowing how the patient's doing. I don't want them to necessarily come to my office, particularly if they think they're sick, because again, there's a risk they're going to transmit this virus to all the people that they come in contact with in the process of coming to my office. So telemedicine is great. When do I need to go to the emergency department? This is, again, a very complex question. We, again, don't want you going to the ED unless you're likely to be relatively sick and may need admission. So I'm telling my patients, if you have mild symptoms, if you've got fever, you're a little bit short of breath, or if you've got mild fever, don't go running to the emergency room. If you start getting short of breath, and short of breath that you can't do walking up a flight of steps or walking across the room, then I definitely want you to go to the emergency department. And if you have milder shortness of breath, I may want to get an X-ray, because the distinguishing feature that I want to know is, do you have pneumonia? Pneumonia is one of the complications of COVID-19, and patients with pneumonia often need to be observed closely. The ER can get an X-ray, they can assess your oxygen level, they can look at your other risk factors and try to prognosticate, are you likely to progress or not? If they think you're mild to moderately ill and are not likely to progress, they may send you home with an oximeter to monitor yourself. If you're a little bit more severely ill, they may admit you to the hospital. What we know about patients who get admitted to the hospital is that they're a relatively small percentage of all patients who are infected. We think, and again, as I said, we've probably grossly underestimated the number of infected people, but in China, only about 20% of infected people ended up going to the hospital. And of all those who ended up going to the hospital, maybe a quarter of them ended up in the intensive care unit. And in the intensive care unit, although everybody realizes this is a sign of more severe illness, that's a place where we could potentially have to do intubation and mechanical ventilation. But that population has also a very good chance of recovering. The across-the-board mortality rate there could be as high as 50%, but it seems to be concentrated generally in older individuals and patients with comorbidity. That doesn't mean if you don't fall in those groups, there's no chance of a prolonged time on a ventilator. But I think those are the general thoughts that we have when we admit a patient to the hospital. How is COVID-19 treated? To answer that question, I think it's important to make the distinction as to whether we're talking about a mild illness treated at home or a more severe illness treated in the hospital. And I think when I've read newspapers and talked to people, even my own patients, there's a lot of confusion about this. people have heard that there are drugs that could be helpful, like Plaquenil, which is hydroxychloroquine. And so everybody, when they call me up and they have a little cough, they say, can I get some hydroxychloroquine? We don't know that those therapies are really going to be effective and worth the potential risk of side effects with mild illness. So when we're treating patients out of the hospital, we're telling them to take their temperature, we're telling them to have fever control. We want people to hydrate themselves, to drink lots of fluids so that they can keep their secretions thin. We want them to rest, again, controlling their fever, but I don't think that we want them to take anti-malarial medicines like hydroxychloroquine. We don't want them taking antiviral medicines like Tamiflu, although I will say that in some settings, when we're not sure if it's the flu or it's COVID, we might treat with Tamiflu for a 5-day course. The anti-malarials can have a number of side effects, and those side effects can include cardiac arrhythmias. So these are not medicines we want to give to outpatients with mild illness. And in addition, there is a population of patients who take these drugs for very serious diseases like lupus. And I have a patient in that situation now who's told me how scared she is because she can't get the medicine to treat her lupus because Plaquenil's been bought up by a lot of people who want to take it in situations where it's really not recommended. So I think when we treat it out of the hospital, it's very different than treating it in the hospital. One other tip, however, for patients out of the hospital, and this may sound a little odd, but we know in patients who are severely ill, one of the ways that we can get their oxygen level better is to have them lying in the ventilator on their stomach rather than on their back, because that redistributes the inflammation and the fluid in the lung in a more favorable way. And then later we turn them back. So if you're at home with a mildish illness, and you're having a little bit of shortness of breath, maybe lying on your stomach for a few hours and then rolling to your side or your other side before you lie on your back might be beneficial. In the hospital, we have a whole different approach to managing people. And the first priority in the hospital is to get the oxygen level up. So we put patients on oxygen. We control their temperature with Tylenol. We give them fluids because many of them come in somewhat dehydrated. And then we think about medications that we can use. We put patients generally on hydroxychloroquine, Plaquenil, but again, we check with an EKG whether they have any pre-existing heart abnormalities that would make it dangerous to use this medication. We usually combine that with an antibiotic. One of them we use could be azithromycin, but the combination of Plaquenil and azithromycin together may present more of a risk to causing heart arrhythmias. And that would be another reason not to do that on your own outside of the hospital. So again, we're using oxygen, fever control, Plaquenil, antibiotics, and then if need be, we're progressing in our supportive breathing to situations where we might need mechanical ventilation. And there are other drugs that are available primarily in clinical trials, because I think those are the mainstays of therapy. But again, importantly, making sure that if you're out of the hospital, you're not thinking that all the treatments we do in the hospital are the right ones for you, because they generally are not. Is it safe to take ibuprofen if you have COVID-19? In general, I wouldn't say that we know it's unsafe, but I think it's preferable that you use Tylenol rather than ibuprofen. And the other thing that's very important is if the reason you're taking it, which is the reason you should take it, is to control fever. The current recommendation is if you have fever, just take the Tylenol around the clock. Follow the directions, but don't wait for your fever to go up before you take it. Just start taking it on a 24-hour cycle. And then after a couple of days, you can stop it. Doesn't mean you should overdose on Tylenol, but it means that that yo-yo effect of starting and stopping isn't currently recommended. Who's at risk of severe disease? I think we're learning the answers to this over time. In my personal opinion, don't have any data to support this, is that there are probably individual genetic variations in the immune response that determine the severity of your illness. Conceptually, at least, early in the course of disease, you're going to get a more mild illness if you have a robust immune response that contains the virus and prevents it from spreading. However, later in the disease, a robust immune response could be above the level that's needed. And if it's much more than needed, and that could happen again because of certain genetic predispositions, you may have excessive inflammation that leads to release of a variety of inflammatory mediators, cytokines, that can cause damage to the body. And I think we're trying to better understand how do we measure and profile individuals to define their risk, understanding that risk of severe disease probably changes over time. How can I continue to get treatment for my chronic conditions in the midst of a pandemic? That is really something we're all struggling with, because the default right now is if you can put it off, put it off. Don't come into a healthcare environment where you might get infected. And some of the testing that we would like to do isn't as easily available. For example, a number of my patients have told me it's very hard to get an X-ray or a CAT scan as an outpatient. And so I think this has to be very much individualized. Patients who have a chronic condition that's decompensating needs to get medical care, and we will arrange that, maybe starting with a video visit, followed by an in-person visit or more diagnostic testing. Patients with chronic conditions that are well controlled and compensated can probably get by with a video visit and continue with their medications. But I think that we are concerned that as this pandemic goes on, there are people with chronic conditions that need to get their usual therapies. And that's something that you have to discuss individually with your doctor and make sure that you're not putting serious problems on the back burner when they need to be taken care of now. So you do want to make sure your chronic conditions are treated. You do want to consult with your doctor, probably by a video visit, to figure out if your chronic condition is stable enough to continue doing what you're doing, or if you need more rapid adjustments and evaluations. How do I keep the rest of my household safe? If you're infected, it's a very, very concerning situation. And the answer again is self-quarantine and isolation. So you want to definitely, if you're infected in a household, you want to go into your own room, you want to have your food delivered to you. You don't want to have any face-to-face contact with your family. And if it's necessary to have any contact, you definitely should be wearing a mask to minimize your potential spread to others. If you're living with elderly people or other people with serious comorbidities, I think you have to be aware that they are at risk. I think you have to be aware that you don't want to contact those people. And if you have an alternative place that they could go to or you could go to so that you're not in the immediate vicinity, that would be ideal, but it's not always possible. So I think you want to keep social distance as far as possible. And I think in general, what I'm advising people who aren't sick to keep their household safe is to minimize visitors, minimize social contacts. I think we're getting very, very good right now at having a lot of video meetings, video conferences. My son has got a new routine on Friday nights. He calls up his friends and they have a group cocktail party via video. So again, all of these are kinds of strategies we have to adopt today. Do patients become immune once they recover? I don't think, again, we have an absolute knowledge of this, but we know that part of the recovery is to develop immunity and to develop antibodies. We're in the midst of getting to a point where we'll get widespread antibody testing to make sure that we know who's been infected and who hasn't. And we presume that if you've been infected, you are immune and you're immune to getting reinfected, because one of the potential therapies under investigation right now is immunoglobulin from previously infected people. Giving preformed antibodies to this disease, which come from people who were infected, may be a potentially life-saving therapy. And by assumption, since the people who've had the disease are likely to have antibodies and immunity, it's likely they will be immune to reinfection. Although, again, what's unknown is how long that immunity will last for, and if in the coming seasons, it's going to protect you going forward. So in closing, I hope that we've been able to cover a lot of material that's of interest to you and important. But I will say for sure, this is an extremely rapidly changing and dynamic field. And I've given you the information to the best of my current knowledge, but I understand that it's very possible, probably likely, that some of the things I said tonight will be different in a few weeks, where the recommendations will change because the knowledge has changed. So I think we all have to work together. I think we all have to make our best efforts to keep up with new information, to protect ourselves and our family. I know this is a trying and challenging time for all of you, a trying and challenging time for healthcare professionals. But I think if we all keep up with information and work together, we're going to get through this, and we're going to get through this with all of us working together and helping each other. Thank you.